So we're going to start with our unit 2, which is the first part of unit 2 is we have to study access to healthcare. Let's see. Access to healthcare, the dilemmas and the challenges that are involved in the access to healthcare. Now we have to keep in mind we have to study in the context of
Ma'am,
India. Yeah, can you hear me?
ma'am, sorry for interrupt. Some girls
Yes.
are unable to join.
Why?
Ma'am, they are sending message on the group, WhatsApp group, that they are unable to join. So that's why I unmute myself.
Okay, no problem. Let's see. Let them try again. Let me write a message to them. Try again. Join नहीं हो रहा है क्यों? Let's see. How do I? We're recording. Let's see. Anyways, continuing on, we want to study the access. The topic is access to healthcare. Access to healthcare, and obviously in the context of India. So this is obviously a challenge. We also know from personal experience how healthcare functions in a country as big as India, and the challenges and the dilemmas that are involved with it. So I'm going to take you through this document, this paper, and then we'll get a clue to what exactly the challenges are. So the Indian healthcare scenario presents a spectrum of contrasting landscapes. At one end of the spectrum are the glitzy steel and glass structures delivering high tech Medicare to the well heeled, mostly urban Indian. So, matlab, we see this sort of a contradiction in the Indian healthcare system. हम जाते हैं बड़ी cities में, you go to Delhi, you see AIMS, you see, those Fortis, big hospitals, very, shiny lobbies and high tech medical care. But then that's on the one end, urban India, cities में India में. But on the other hand, there are these ramshackle outposts in the remote reaches of the other India, trying desperately to live up to their identity as health sub-centers waiting to be transformed to shrines of health and wellness, a story which we will wait to see unfold. मतलब we do go to then smaller towns, even rural areas में वहाँ तो मतलब वो लगते ही नहीं है कि वो health care centers है. वहाँ तो obviously we don't see hospitals. The clinics that we see, they don't even look like healthcare centers because the hygiene level is so bad, the facilities are so bad and so backward that the kind of healthcare that they would be providing would be obviously very compromised. तो ये दो पहलू हैं हिंदुस्तान के, right? So with the rapid pace of change currently being witnessed, this spectrum is likely to widen further, presenting even more complexity in the future. Okay, anyways, but we have to understand that healthcare is not something which is new, obviously, to the Indian culture. We know that the tradition, the health tradition, जो है medical tradition of the Indus Valley civilization, which was called Arogya, which meant holistic well-being, that is so old. That is 5000 BCE. That is like, extremely the one of the oldest health care traditions in the world. So even despite that, itni history ke bawajood, we don't find good quality healthcare in many areas, especially rural areas in India. So those are the challenges. Now, what are these challenges? That's what we want to study. What are the challenges in delivering healthcare to everyone, which must include the socially disadvantaged? You see, healthcare tab अच्छा है जब सोसाइटी के तमाम अफराद तमाम जो भी लोग हैं उनको अच्छी तरह से ये फराहम हो रहा है अगर आपको याद होगा इन द फर्स्ट लेसन वी स्टडीड वन ऑफ द फोर बेसिक moral principles of medical ethics is justice that means healthcare should be there should be an equitable a just distribution of healthcare and its resources सबके पास कोई किस्म की accessibility होनी चाहिए to healthcare. That is one of the most important moral principles of medical ethics. But we see that being compromised, especially in India, which is a huge country, that most people do not have access to good healthcare. And that is primarily sometimes because they are economically challenged. Sometimes the system itself does not work, so it's systemically marginalized. What keeps us from reaching the everywhere, which must include the remote areas in our Himalayan region, for instance, where until recently essentials were airlifted by the Air Force helicopters. So, matlab, you see if it's a huge country with lots of people living in तो उसका health care भी उसके मुताबिक ही होना चाहिए so these are the challenges that we have in this field so it's I shared this document with you क्योंकि इसमें बड़ा आसान हो जाएगा आपको याद करना when you have this question about the challenges or access to medical health care, medical, facilities, you just have to remember these 5 A's. What are the challenges? 5 A's. The challenges are 5 A's. Number one, आप ये लिखेंगे. I hope everyone's taking notes. I'm going to share this anyways with you, but it's good if you take notes. It helps you memorize. Number one challenge of when it comes to access to healthcare is awareness or lack of it. मतलब लोगों को पता ही नहीं है. You know, because of lack of education in many rural areas, many people don't even understand that a particular thing is an illness or a particular thing has to be treated appropriately. Yeah, doctors can treat this illness. So lack of awareness is one of the biggest challenges to access. जब पता ही नहीं है, जब समझ ही नहीं है, जब इल्म और तालीम ही नहीं है, तो फिर इंसान कैसे access करेगा? So how aware is the Indian population about important issues regarding their own health? Studies on awareness are many and diverse, but lacune in awareness appears to cut across the lifespan in our country. As in, इतनी कम awareness है कि we don't know how to deal with it. For example, I'll give you an example. जब COVID हुआ, lots of research was done throughout India just to understand how do Indians understand a pandemic. How should they, how do they understand इसके जो standard operating procedure होना चाहिए, जो आपको precautions लेने हैं. And the result was very alarming because most people could not even understand what was happening. And when they couldn't understand, obviously they were uh, vulnerable. उनको हो सकती थी ये disease और जो कि हमने देखा बहुत ज़्यादा harm भी इंडिया में हुआ. So adequate knowledge regarding breastfeeding, for example, practice was found only in 1/3 of the antenatal mothers in 2 studies. Like, for example, they're giving examples. Matlab, this is a basic thing, how to take care of children. Even basic, healthcare or medical issues, even those basic issues are an issue in India because of the lack of awareness. तो पहला आप challenge लिखेंगे awareness or the lack of it. या लिखेंगे lack of awareness क्योंकि we are going with the 5 A's. So these are the examples that the writer has given. Like, for example, a study in urban Haryana found that only 11.3% of adolescent girls studied knew correctly about key reproductive health issues. मतलब सिर्फ 11% girls knew about the biological issues that everyone should have some knowledge about. So so, why is the level of health awareness low in Indian population? The answers may lie in low educational status, poor functional literacy, low accent on education within the healthcare system, and low priority for health in the population, among others. तो ये है factors. अगर आप पूछना चाहेंगे क्यों awareness क्यों कम है हिंदुस्तान में when it comes to this access to healthcare, or why are people unaware? Primarily, it boils down to education, क्योंकि education कम है, इसीलिए functional literacy कम है, उन्हें पढ़ना नहीं आता, लिखना नहीं आता, पता नहीं है फिर क्या करना है, और उसकी वजह से जो priority दी जाती है to health and to education which is related to that, वो भी कम है, इसीलिए awareness कम है. Right, so that's very easy, we can understand, we can relate to this. What is encouraging is that efforts to enhance awareness levels have generally shown promising results. For instance, a study in Bihar and Jharkhand demonstrated improved levels of awareness and perceptions about abortion following a behavioral change intervention. मतलब बताया जाया मतलब they did this research that if, for example, a population is educated, then they do show better signs of awareness, obviously. So that means what is lacking is the education, what is lacking is the awareness. A review on the effectiveness of interventions on adolescent reproductive health showed a considerable increase in the awareness levels of girls with regard to knowledge of health problems, environmental health, nutritional awareness, and reproductive and child health following intervention. अगर कोई by these interventions they mean programs. If you remember, हमें स्कूल में कभी program होते थे या कभी you have these health उन्हें क्या बोलते हैं health campaigns sometimes in our cities. Usually it doesn't happen in cities so much, in rural areas. So ये क्या होता है, government funded awareness programs for people discussing important issues on, let's say, adolescent reproductive health, yeah, environmental health, yeah, other health issues. So the government has to take the initiative. The government has to take the initiative to educate people, or tab awareness aayegi. So the message is clear. We must strive to raise awareness in those whom we work with and must encourage the younger generation to believe in the power of education for behavior change. तो ये भी समझ आ गया, अगर पहला डिलेमा और पहला चैलेंज एक्सेस टू मेडिकल केयर का है अवेयरनेस, कि लोगों के पास अवेयरनेस ही नहीं है, इतला ही नहीं है, समझ ही नहीं है, वो दूर हो सकती है अगर एजुकेशन दी जाए. डन, नंबर 1. नंबर 2, एक्सेस और लैक ऑफ इट. तो मतलब एक्सेस टू हेल्थ केयर कम है. दैट मीन्स अब अगर अवेयरनेस भी पता है मगर अब एक्सेस नहीं है. आपके इलाके में छोटा सा कोई गांव है, वहां क्लिनिक ही नहीं है. अगर क्लिनिक है तो अच्छे डॉक्टर नहीं है, फैसिलिटीज नहीं है, सामान जो है, दवाइयां जो है वो नहीं है. So access to healthcare is defined by the Oxford Dictionary as a right or opportunity to use or benefit from healthcare. Again, when we look beyond the somewhat well connected urban populations to the urban underprivileged and to their rural counterparts, the question, what is the level of access to our population to healthcare of good quality, is an extremely relevant one. मतलब तीन किस्म की populations हिंदुस्तान में है. एक है urban population, they have good access, the urban population. So cities like Delhi, Mumbai, Kolkata, मगर urban population में भी underprivileged है. So people who live in extremely difficult situations within these urban centers. So as we've seen, people who live in slums and very, very difficult positions, there are situations in these urban areas. और फिर rural है जो villages में रहते हैं, तो उनके लिए access बहुत ज़्यादा मुश्किल होता है. Now, let's see this. Okay, they've given us a paper. They'll give you examples. Is a good thing. 2002 paper speaks of access being a complex concept and speaks of aspects of availability, supply, and utilization of healthcare services as being factors in determining factors in determining access. Okay. What is this? Okay. हाँ, so utilization of healthcare services, क्योंकि ये तो सिर्फ एक चीज नहीं है ना. There's so many things. You need specialized doctors, you need facilities, you need the hospitals, the infrastructure जहाँ treatment होगी, you need other kind of staff. तो इतनी सारी चीजें जो है, अगर एक भी कम हो, उससे access to healthcare will be compromised. Okay. Then what else? Now, even if a healthcare facility here, even if a healthcare facility is physically accessible, what is the quality of care that it offers? Like we said, it's not just about the accessibility. Let's imagine we are living in a village and we need to access कोई छोटा सा clinic. मगर उस clinic में क्या है? मसला है कि clinic तो है, मगर डॉक्टर अच्छा नहीं है. अगर डॉक्टर है तो कोई उनके पास वो जो ये इक्विपमेंट चाहिए वो नहीं है. सो दैट इज ऑल्सो, या अगर सब कुछ है, डॉक्टर भी है, क्लिनिक भी है, इक्विपमेंट भी है, मगर जो क्वालिटी वो दे रहे हैं, क्वालिटी ऑफ हेल्थ केयर वो वहां नहीं है. ओवरऑल क्वालिटी, या तो वो ज्यादा ट्रेन नहीं है, या तो खराब है मशीनरी और इक्विपमेंट. सो ऑल ऑफ दैट इज compromising on the access or accessibility of healthcare. Quality bhi jab nahi ho, so that also means that there is no access to good healthcare. So for example, यहाँ ये लिखा है. Now infrastructure, now let me give you this study. The National Rural Health Mission has done much to improve the infrastructure in the Indian government healthcare system. A 2012 study of 6 states in India revealed that many of the primary health centers lacked basic infrastructural facilities such as beds, wards, toilets, drinking water facility, clean labor rooms for delivery, and regular electricity. So मतलब आप देखिए, ये प्राइमरी हेल्थ सेंटर्स है, वो है जो बेसिक, कोई स्पेशलाइज्ड हेल्थ सेंटर नहीं. प्राइमरी मतलब बिल्कुल जो बेसिक हेल्थ केयर के लिए चाहिए, क्लिनिक्स या हॉस्पिटल्स, वहां भी बेसिक अम्यूनिटीज लाइक बेड्स, वार्ड्स, टॉयलेट्स, ड्रिंकिंग वाटर फैसिलिटी नहीं थी. दिस वाज डन अंडर नेशनल फंडेड this study. So that tells us that this is a challenge, a big challenge. Acha, we should identify and analyze possible barriers to access in the financial, geographic, social, and system related domains, and do our best to get our students and peers thinking about the problem of access to good quality healthcare. So that means all of us, in some way or the other, the fact that we are studying medical ethics, we should identify and analyze possible barriers. What are these barriers to access in the financial, geographic, social, system related domains, and do our best to, because the access jo challenges to access have different facets. One is financial. So for example, the government hasn't allotted much funds to the establishment of clinics and hospitals in a particular village. तो पैसा नहीं है उसके लिए, या अलॉट नहीं किया गया है, या अच्छी तरह यूज नहीं किया गया है. जियोग्राफिक, फॉर एग्जांपल आप करगिल में रह रहे हैं, या कहीं ऊपर कहीं अनएक्सेसिबल किसी जगह में रह रहे हैं, तो वहां एक्सेस इज अनदर चैलेंज. अच्छा, सोशल, social भी एक factor है. It's a barrier. For example, there are many kind of hospitals where a particular, maybe a caste would not be allowed because of the society that lives around the locality, the place where the hospital is. So there's so many factors, and these are barriers that have to be removed. Now, number three, moving on. So we did awareness, we did access. Number three is absence or the human power crisis in healthcare. Absence or the human power crisis. That means qualified staff which is required for healthcare is not present. So, any discussion on healthcare delivery should include arguably the most central of the characters involved, the human force. So, do we have adequate numbers of personnel as they appropriately? Are they appropriately trained? Are they equitably deployed? And is their morale in delivering the service reasonably high? So बहुत सारी चीजें हैं. या तो adequate numbers आपके पास है doctors के, या तो are they appropriately trained, और are they equitably deployed, मतलब जहां उन्हें होना चाहिए क्या वो है. अगर आपने नर्स को डॉक्टर की जगह पे रखा और डॉक्टर को एडमिन की जगह पे रखा, that's wrong. So, is their morale high in delivering the service? So, are they, sort of motivated to do this job? So, ये सब जो है, this is also one of the biggest challenges, which is workforce absence or the human power crisis or workforce crisis in India. Even though the population of India is so high, India is about to become the most populous country in the world. मगर because healthcare is such a specialized field, you need very specialized, extremely educated people in this field. तो वो जो लोग हैं वो कम हैं, और क्योंकि education in some places is very low, so that becomes a challenge. अच्छा, यहाँ देखिए ये स्टडीज भी हैं. 2011 की स्टडी estimated that India has roughly 20 health workers per 10,000 population, with allopathic doctors comprising 31% of the workforces, nurses and midwives 30%, pharmacists 11, Ayush practitioners 9%, and others 9%. That means for every 1,000 people, सिर्फ 20 health workers हैं, according to this study, which is so less. The ratio is so less. 10,000 लोगों में सिर्फ 20 है हेल्थ केयर वर्कर्स. उसमें से जो एलोपैथिक डॉक्टर्स, जो रेगुलर डॉक्टर्स होते हैं, वो 31% है. नर्सेज और मिडवाइफ्स जो होती हैं वो 30 है. फार्मासिस्ट 11 ही है. आयुष मतलब होम्योपैथिक प्रैक्टिशनर्स 9% है, and others 9%. So this is very less, and especially this becomes a challenge if, God forbid, there are epidemics and pandemics, जो हमने देखा कोविड के वक्त. 10,000 लोगों के लिए सिर्फ 20 health workers. So this is a big challenge. अच्छा, ये भी एक चीज है कि private health sector accounts for most of the health expenditures in the country. The state-run health sector still is the only option for much of the rural and peri-urban areas of the country. Meaning, there are so many privately held hospitals. मगर फिर भी most of the Indian population goes for rural, for state-run government hospitals because it's financially better for them. It's cheaper, right? So वहाँ जो facilities हैं, वहाँ facilities are even more compromised. So that becomes a very big challenge. This one. So, as trainers and educators in public health, how are we equipping our trainees to deliver a health service in the manner required at the place where it is needed and at the time when it is essential? So, third wala bhi aap अच्छी तरह से ये याद रखेंगे. It is the absence or the human power crisis in healthcare. Moving on, fourth is affordability. Fourth is affordability. Affordability, obviously, the cost of healthcare. The cost of healthcare. Now, if even if it's accessible, even if it's good, even if there's education about it, magar most of India lives in very difficult these conditions. Most of India lives in extremely difficult financial conditions. So how are they going to afford the healthcare. So, quite simply, how costly is the healthcare in India, and more importantly, how many can afford the cost of healthcare? So, it is common knowledge that the private sector is the dominant player in the healthcare arena in India. So, private sector, jo hai, they have the best healthcare. We all know that. We've seen that. And that's true, but then the costs are extremely high for private sector healthcare. The public sector offers healthcare at low or no cost, but is perceived as being unreliable or indifferent quality, and generally is not the first choice unless one cannot afford private care. So, जो public sector है, government hospitals or clinics है, they do give affordable healthcare at low and no cost also, but we do have this general perception that it is low quality and it is inadequate. Facilities वहाँ होती है, low quality होती है. So usually people prefer private sector healthcare, but the costs are too high. So this is the fourth challenge in the access to healthcare, which is affordability. Now, obviously, this can be addressed by the government if, for example, people are given access to good healthcare, the quality of government sector healthcare should be improved. So this is something that can be removed. Just for example, हमने पढ़ा पहली जब problem हमें आ रही थी, which is awareness, that can be removed by education. Here, this can be removed by improving the quality of these free government hospitals and clinics. And fifthly, which is last, accountability or lack of it. Being accountable has been defined as the procedure and process by which one party justifies and takes responsibility for its activities. So, matlab, basically, there is a lack of accountability. When there are these lapses, we hear of so many lapses in healthcare system. Ki so and so passed away, or so and so suffered this particular problem because of the errors or the the lack of professionalism by the hospital staff. मगर वहाँ accountability ही नहीं है. There is no accountability. The legal system does not hold them accountable. The government as such is not holding these people accountable. So because of the lack of accountability, one of the biggest challenges, this becomes one of the biggest challenges to the healthcare, access to healthcare. So you want to access healthcare, but you know that if there are lapses, कुछ problem हो जाएगी, कुछ God forbid कुछ हो जाएगा, accountability है ही नहीं. There is no one that you can hold accountable for these lapses and for these, issues that happen. So lack of accountability is the fifth one. So we're done with this one. Let's see the other one. Yeah, this one is also related to the same thing, issues of unequal access to public health in India. So just for example, if you get a question, essay type hoga, या अगर short type भी होगा, write a short note on the issues related to, or the issues or the challenges or the dilemmas related to access to healthcare. You would write, जो हमने अभी पढ़ा, the 5 A's. You're going to write a short note as an introduction about how access to public health care system is extremely important for all societies, this, and then you'll go to the 5 A's. These are the 5 challenges: awareness, access or lack of access. Number 3 is absence of human power. Number 4 is affordability, and number 5 is accountability. Okay, so almost we're done. Here also it's the same thing. Medical expenditure. That means जो हमने बोला affordability. one of the biggest challenges to this, access to healthcare is affordability, is the financial pressure that healthcare systems put on people. So that is one of the biggest challenges, and that can be addressed only if the government steps in and makes government healthcare centers and hospitals free and affordable, and good quality healthcare is provided through these healthcare centers.